Okay, this is a book review. The name of the book is This Is Your Brain on Food. The author's name is Uma Naidoo. She's a psychiatrist at Harvard. And I'm going to tell you, this book was so stupid, it was impossible to take it seriously. And it's not so much the author's fault as it is just the way things are. What I mean by that, if you read a lot of nutrition books, you read a lot of stuff by Ivy League authors, what you'll see is very few of them do any thinking. What they all tend to do is to copy each other. And so it's been established in the university community, including in the Ivy League university community, that the Mediterranean diet is the best diet and everything from the Mediterranean diet is good. So they all just copy each other. None of them really know what they're talking about. It's not a joke. I've seen some videos of this author, and she means well. She wants to help people, but she's been told the Mediterranean diet's the best thing, so that's it. And there's other famous doctors coming out of Harvard. They're all sort of promoting Mediterranean diet or some version of the ketogenic diet. It can slow the brain down a little bit for prevention of, seizures in patients with refractory epilepsy not responding well to medications. But I don't think the average person's goal is to slow their brain down and potentially slow their cognitive function down. I think she's going to look back on this book as an embarrassment. I think they all will someday. But you have to remember, the money comes from promoting stuff like the Mediterranean diet. You promote Mediterranean diet, people are going to like you. They're going to invite you to interview on all the popular channels. You carry with that the prestige of an Ivy League university and a title as a psychiatrist. That gets you invited. That can make you famous. That could bring money for you. Lead to opportunities. Telling the people the truth, that doesn't do anything. That gets you ostracized. Okay, what does she say? She says people should avoid white rice and potatoes. Well, notice that's a direct contradiction to Dr. McDougall and myself. All the Asian people eating white rice are skinny. The populations that eat potatoes are skinny and healthy. She does point out some obvious stuff, the kind of usual scapegoats get blamed for stuff, and they are bad. Excessive simple sugars, high fructose corn syrup, aspartame, all that stuff. But a typical stupid comment, she says, omega-6 oils should be consumed in moderation. No, they shouldn't be consumed at all. None. Zero. Then she says things like, extensive scientific evidence has demonstrated that MSG is safe at ordinary levels. As a result, many experts believe that MSG dangers are all hype. Now, anybody who studied MSG knows that that's just the industry-sponsored, funded position. MSG is a major neurotoxin. The glutamate, whether it's MSG or MFG, it's an obvious neurotoxin. That goes all the way back to the research only in the 1960s. Okay, and then she says in ordinary levels. Well, what does that mean? They put tons of that stuff in foods, and people eat multiple foods that have that stuff in it. So, all right, here's another example. On page 53, the Mediterranean diet, which can include dairy, cheese, yogurt, olive oil, canola oil, poultry, alcohol, nuts, nut butters, fish, grass-fed beef, eggs, avocados. Diets are beneficial for patients with depression. And then it goes on to say that the Norwegian diet is known as the Nordic diet. And the biggest difference between the Nordic diet and the Mediterranean diet is that the Nordic diet emphasizes canola oil rather than olive oil. And that the Norwegian and the Mediterranean diet were both associated with less depression, though the evidence was limited. What I'm trying to tell you, this is like, an open message to the pros. Don't fall for this BS, okay? Canola oil and olive oil, they're both bad. All of this is a bunch of nonsense. And I'll just give you some logic to compare that with. Compare it with this statement. This is a statement that I just wrote. People are more attractive when they are thin and have good blood flow to their skin. Low-fat vegan diet with no oils makes people thin and provides better blood flow to the skin. It makes people more attractive. People are happier when they are healthy. Low-fat vegan is associated with less of all the following diseases. All the following diseases will be more common with the Mediterranean diet. Here we go. Less obesity, hypertension, fatty liver, diabetes, coronary artery disease, impotence. These diseases are so common. If you told me a patient was, again, 55, 60 years old, I would just expect them to be overweight, hypertensive, have a fatty liver, and be pre-diabetic or diabetic with coronary artery disease and impotence and abdominal pressure syndrome. I would expect it. I wouldn't even look in the chart. If you told me, you got to do a biopsy or a drainage, some type of procedure on this patient, I would just assume they have all those diseases. That would be the normal thing to assume. And the vast majority, almost all of them, would have all those diseases. Okay, GERD, hemorrhoids, hernias, varicose veins, western abdomen, degenerative disc disease of the spine, DISH, diffuse idiopathic skeletal hyperostosis of the spine, ossification of the posterior longitudinal ligament. I see these things all day long in the majority of patients, okay? Cataracts, glaucoma, age-related macular degeneration, vision problems. Tons and tons of patients have cataract surgery. The bottom line is, like, when I look at a CT scan of the brain, I'll sometimes see the eyes first, and I see cataracts, unilateral, bilateral cataract surgery. I look at the teeth, poor dentition. I basically know the patient's probably got cognitive decline because they almost always go together, All right, autoimmune disease, cognitive decline, etc. The low-fat vegan diet diminishes all of these. So what I'm trying to say is, how could people be happier and less depressed and have good cognitive function if they're eating diets that cause all these diseases? And this is why I'm also saying it's obvious low-fat vegan with no oils is better, because it helps prevent all these diseases. It's the only diet shown to reverse coronary artery disease. Come on, it's kind of obvious when you use your brain and you think you cut through the BS. Okay, then I would also say people underestimate the value of Dr. McDougall figuring out that a 90% starch-based diet optimizes health. There's so much noise out there. There's so much industry-funded nonsense. There's so much irrelevant stuff that, like I said, there's, canola oil versus olive oil, Mediterranean versus Nordic diet. That's arranging the deck chairs on the Titanic. It's just stupidity, okay? McDougall's starch will get you where you want to go, make you healthy. That's valuable. That's very valuable. I can tell you, I've been a doctor over 30 years. The most valuable thing I ever learned in my whole life is that humans, in terms of health, is that humans should eat a starch-based diet. That's the most valuable thing I ever learned. Because it works. You need something that works. Most stuff is just BS. That works. That makes people skinny, and you avoid all these diseases. And that's the path to health. Having good blood supply to your brain, your heart, your Johnson. Okay. Another way is the question arises, how can one tell the difference between truth and nonsense? And one way is that nonsense will contradict itself. What I mean by that is, you'll hear all these doctors, all these Ivy League doctors, big famous university doctors telling you how good it is to eat fish, how important it is to eat fish. But then when you take a closer look at salmon, 50% protein and 50% of the calories from fat. Well, it's impossible for food to be good with that high of protein and that high of fat, and especially it's animal protein. Okay, and then of course fish are associated with mercury toxicity, like the book by Jane Hightower, all these demented yuppies because they were trying to be healthy by eating more fish. It's just overtly, patently stupid, okay? You can't polish a turd. It's highly acidic. The ocean is basically a sewer, all the pollution, and then the animals higher on the food chain, like the bigger fish that people tend to eat, just accumulate all those toxins, the PCBs, all the estrogenic chemicals. My own view, let's see, where is this? Let's see. Oh, here's another quote that she makes about psychiatry. I thought this was a good quote. This is an honest quote. Listen to what she says about psychiatry and psychiatric diagnoses. Like I said, I think she means well, and she's really trying to do a good job. What I sort of think happened here is she's trying to teach herself nutrition, and she doesn't really know enough yet. So she wrote the book to teach herself, is the impression I get. But she does say some good, true things. Listen to this. She says, my own view of where we went wrong in psychiatry is this. Psychiatry diagnoses have no statistical validity. Listen to that. Psychiatry diagnoses have no statistical validity. And the conditions have no biomarkers of specific diseases. That's a medical way of saying that psychiatric diseases are just made up, which is true. Okay, then she says, diagnoses are simply a list of symptoms. We assume, big word there, we assume that when a person presents with psychological symptoms, that the problem is solely from their brain. However, given what we have reviewed so far, it is clear that organs such as the gut play a role in how we think and feel. Well, that's a big statement. That was a big statement on her part. So she's basically saying is, we used to think a psychiatric disease or psychological disease is just a brain disease. But we now know if you have metabolic problems in your abdomen, in your gut, that can cause psychiatric, psychological symptoms. Well, that was a big statement on her part, and that's good that she points that out. Okay, she continues on. A better diet can help, but it is only one aspect of treatment. You cannot eat your way out of feeling depressed or anxious. Food is not going to relieve serious forms of depression and other mental illnesses. Okay, so She does say it's just one part, and it's variable how beneficial it can be. I think in kids it can be even more dramatically beneficial. So overall, I'm going to show you a couple of papers I got from this book. The book was good in the sense that it motivated me to look up some papers. So here's some papers. Association between obesity and psychiatric disorders. Yeah, obesity people have more psychiatric disorders. They're more often depressed, more likely to have panic disorders like agoraphobia. And, you're going to be sad. If you're fat, you're less attractive, and people are going to be less want to, be your boyfriend, girlfriend, Okay. To a man, he sees a woman when she's fat, it looks like she's pregnant. Our ancestors, only a pregnant woman was fat. So, it's dangerous to approach a woman. The guy's afraid somebody's going to beat him up or do something nasty to him. So, if you can't make a baby with her, why approach her is kind of like what our primitive biological mind thinks. Okay, association between frequency of fried food and depression in Japanese. Yeah, the more fried food they ate, the more depressed the people were. Omega-6 causes brain damage. Okay, myeloperoxidase, that's MPO. It's released by neutrophils in the setting of high dietary fat. I gave previous lectures where I was talking about the glycocalyx. The myeloperoxidase, it's released. It's part of their toxic response to infection. So it's prothrombotic. It damages the glycocalyx, the lining of the endothelium. It causes, release of increased reactive oxygen species, leading to increased oxidative stress. It's prothrombotic. It increases the risk of venous thrombosis. Atherosclerosis in arteries is a blood clot, of coronary artery disease, of cardiac arrhythmia, of peripheral arterial disease in the lower extremities and the legs, of myocardial ischemia, heart attack, of stroke. It's bad, okay? And high-fat diets cause that. So why would you want to eat more fat? Stupid. Okay, here, magnesium and major depressions. The bottom line is, magnesium deficiency is one of the most common dietary deficiencies. Americans are deficient in dietary fiber, they're deficient in magnesium, they're deficient in potassium, and they're deficient in nitrates, the nitrates that are precursors for nitric oxide. And the reason's obvious, because they don't eat enough plants. You eat your plants, you get all this stuff. So, lack of magnesium is associated with increased risk of depression. It's associated with increased excitotoxicity in the brain because normally magnesium blocks the center of the MDAR, that's the NMDA receptor for glutamate, and by blocking it, it prevents overactivation of that receptor. You need magnesium to hang on to the second and third phosphate in ATP, the energy currency of a cell. So if you're low on magnesium, you won't run your ATP-dependent enzymes as efficiently. So that's bad, which includes your sodium-potassium plasma membrane pump in all your neurons. That's about half to two-thirds of the energy expenditure in those neurons. So you're really messing up your function at a pretty basic level. When you're stressed out, you lose more magnesium in your urine. So excessive psychological stress will cause a loss of that. Alcohol, fluoroquinolones, diuretics, and some other medications like aminoglycosides, for example, will cause more loss of magnesium in the urine. Where is magnesium found? Magnesium is located right in the center of chlorophyll. So you eat plants. That's where you get good sources of magnesium from. So what I did was I went through the back of the book and just looked at all the references and then picked out a few that I thought were interesting, including the ones I'm showing to you now. Oh, talking about caffeine, that it causes anxiety, caffeine-induced anxiety, because it increases sympathetic autonomic nervous system. It increases glutamate transmission in your hippocampus and other brain areas. Okay, so why would you want to do that? So it increases the risk of excitotoxicity. And of course, aspartame is toxic, And I like this article here because it mentions what's in aspartame. Aspartame is a combination of phenylalanine, amino acid, aspartic acid, which is like baby glutamate. It's another excitatory amino acid neurotransmitter, so it increases the risk of excitotoxicity. And also methanol. And the methanol gets broken down into formaldehyde, which is carcinogenic and toxic, okay? That's why I would never have anything with aspartame. That's also why if you're buying a shirt, I would never buy a shirt that says you don't need to iron it, because usually they put formaldehyde in there, which is toxic, okay? And she talks about aspartame can increase headaches, insomnia, seizures, and of course it's associated with a whole bunch of other neurologic problems. You don't want it. So anyways, I hope that was interesting.